You alright?
Hi. Come on in.
Yeah.
Hi, how can I help?
Right, where do I start? I know what's the problem. It's basically food poisoning,
Right, okay.
additives.
Mm.
The inflammation is basically going down my groin. I've got burning in my kidneys. I'm 70%. So I found out of kidney failure because when you pee in the toilet and it's all frothy for a long time, then that's due to kidney failure.
Oh right, so your pee's quite frothy when you pee
For a
in.
long, yeah, it's been going on for I don't know, a long time.
Okay.
Yeah, all my side keeps swelling up every single morning.
Yeah.
But when I leave the house, when there's no 5G around, it's okay. And then I've looked into things and I found out that there's been a fungicide being sprayed over our fruit and veg and all that. That the actual 5G. There's 3 designs that have been brought out. But yeah, it's all due to our food.
And how long has this been going on for now?
Years.
For years. Is it any worse than usual
Yeah,
recently?
yeah, it's got worse. That's why it's
Worse.
kidney failure.
Worse in what way?
All the burning in the kidney's gone onto
So
that
it's
side.
hurting more? Or
It's
it's
gone onto that
moved
side. Onto that side now as well.
Yeah,
It was just on this side. All my ribs and that all inflamed, all through there's all inflamed.
Okay.
Down to my groin, burning in my groin. I had crystallisation in my nose. I woke up, my nose was completely crystallised. Eyelids crystallised, and that makes me think because I've done detoxes and I've cleared out the parasites and everything. All the foggy heads and everything cleared up.
Brilliant.
I've done that for my mum as well. Same thing. Her head cleared up as well. She's been eating the same foods and everything. Parasites is the problem, even though your tests don't show it. But anyway, we won't go down that way. But yeah, I found out in 2014, Mr. Farmer, your drug supplier, jabbed up the pigs in America, and that was what was crystallising the birds' lungs. And
Okay.
And yeah, they were basically in the carcasses in the food factories. And
but your symptoms today are that pain is moving.
Yeah, onto the other side.
Onto the
But
other side.
it's always the same.
Your wee is quite frothy.
It
Are
is,
you going
yeah.
for a wee more often or having to run to the
Yeah,
toilet?
well, going to the toilet varies. Sometimes I can go, sometimes I can't. That's because all this is inflamed and it's stopping me from going to the toilet.
Any blood in your wee?
Not that I've noticed. But
Okay, does it hurt when you go for
I've
a
got
wee?
in my poo, there's a load of white fibres.
Load of white fibres in your poo?
Yeah. Yeah, and that's down to what I tracked it down to was the water supply. But then I phoned the water people up, Welsh Water. They came down, done their stupid little tests because basically they didn't test for the stuff that I told them that I found out that it is. Because I looked at the funguses and all that and found out exactly where it's coming from. And yeah, they basically tested on the things that they're going to pass for, and that was it. And then when I phoned them up, they hung up on me. When I turned around and told them to do a proper test.
Threadworms, so they're tiny little like wriggly things you see
No,
in
it's
your
fibres.
poo.
No, it's fibres.
Okay.
Yeah, I've looked it up with a microscope and everything. I
Okay.
bought my own kit because I do not
Okay.
trust any opinions lately. It's,
Fine. Well, I'd probably do 2 things. Have a feel of your tummy
yeah.
and also check your wee sample. Is that alright?
Yeah, if I can go on, yeah.
Yeah, fine. Yeah, if you want to pop up on that with me.
Yeah.
Fine.
And yeah, basically it's going from there, from my ear, and I've had my ears clogging up as well.
Okay.
Like proper clogged up, can't hear out of it. I've had all sorts of issues going on.
Yeah, it's okay.
Yeah.
Okay.
But it's all
Feel of
down
your
to-
belly.
Yeah.
Just relax your head down. How often do you go to the toilet for a poo?
First thing in the morning, pretty much straight away. Then I need to go again because like, my chest's all bloated out, all the rib cage and everything. And I've got to push into my rib cage to get the air out and loosen things up. And, yeah.
So you feel around your tummy there. Does that hurt at all when I'm pressing?
No. Normally, the pain's normally
around there.
around here.
Right, okay.
And then it got every now and again I get like a burning, like acid going through my groin. And I've been having clots as well in my groin.
Okay.
I've had little lumps in my
Little
groin,
lumps, okay.
but they've gone now, thank God.
Let's have a feel here. Does that hurt around the back there?
No.
No.
It's
Okay.
mainly on this, like,
Does it hurt around the back here?
no, but that's where all the air's building up.
But that's where the air's building.
Yeah, so when it is inflamed, that's when it's hurting.
Just
But at
take
the
some
moment-
nice deep breaths. Okay, so that's when it hurts.
When it's all
It's
inflamed.
painful.
Mainly first thing in the morning.
Okay.
As soon but when I get out of the house, it's for something else.
Just
I know
small
why.
deep breaths a second. And out. Okay, let's have a listen as well. Okay, yeah, that sounds alright. Can you do a urine sample? Then I'll give you a pot. Fine, just put back out to reception.
Right.
And yeah, come straight back in when you're done. Leave your stuff.
All right.
here.
Yep.
Hiya. How'd you get on?
Brilliant.
Fab, thank you.
Oh, and also, I've been having problems with my testicles.
Right, what
They've
kind
been-
of problems?
Like, problems. Like, they've been, like, swelling up in my stomach.
Swelling up in your stomach?
Yeah, and the only thing that I can count that down to is the rubbish test. I looked up the science test that they done to make things good for human consumption. And it's, basically they tested on 150 people over 15 years, 10 people a year, for Bovair to be safe to added to cattle feed. And there's only, I think it was like 56 views, or reviews, whatever they call it. So, yeah, but basically that's making people impotent. That is, yeah, and that is the only thing that, basically, anytime I eat anything dairy, then I have issues.
Have you had any lumps in your bowels at all? Sorry, in your testes at all, in your balls?
No, not I know.
No. Are they painful, sore to touch?
Sometimes when they're all swollen up in my
Sometimes
stomach.
they're Yeah,
But, yeah.
your testes are swollen. So, sorry, inside your stomach they get swollen?
Oh yeah, they go right up in the,
Okay.
into
yeah,
the bone
sometimes
structure,
they
like.
can do.
Yeah.
Yeah.
and that's
Okay.
not normal.
Any burning, stinging at all when you're weeing?
No, not really. Every now and again, like, but not very often.
Does that happen at the same time that you feel your
No,
testes
no,
are
no,
swollen?
no. I just go really dizzy and feel ill as hell, and yeah.
Mm.
But that's down to the Bovair. I guarantee 100%. because that's the only, there's nothing else that has been brought out that these sickos have put into our food.
There's a little bit of extra protein in your wee.
Alright, that is a protein leakage through kidney failure.
Right, well potentially. The
No,
last
it
urine
is
sample
of-
we sent off to the lab was
Right.
actually normal.
Yeah, I know,
But if you
but
wanted
your
to submit
tests,
Okay.
especially when you're using PCR tests.
Right. Well, if you want to submit another test to the lab, we can certainly test it again.
Are you going to use a PCR test? Because if it is,
What do you mean
I'm
by a PCR test?
the PCR test
As
that you
in
use.
polymerase chain reaction?
Yeah, the one where you've got to multiply it a certain amount of times before it gives a correct reading.
Right, I don't think the albumin creatinine ratio, that's what they test. I don't think they use as PCR.
Right, okay.
That's usually for
It's the
testing for
normal one.
bacteria and viruses.
It's the normal one that they use, yeah. Oh, and fungus as well. And heavy metals I need to be tested for. Because that could also be an issue.
Right.
Because
Well,
the fungus is definitely, I cleared it out. Head started going, things, all the dizziness and everything started going, my hearing and everything started getting back to normal. And I've also been having shakes and that, like my nervous system in the morning, like that, and I can't control my legs or anything. And that's basically down to parasites attacking your nervous system.
we can certainly do some blood tests. In fact, I think I can see Dr. Rudley recommended a load of blood tests. I think those are all sensible ones.
Yeah, they'll come back. Yeah.
Well, you haven't had them.
Go on.
She recommended some at the end of April, but you haven't had any blood tests.
April.
Yeah. That was when you submitted some urine and that came back normal, but you didn't have any blood tests.
Oh.
Okay, well, book in for some blood tests. We'll know which ones. I
Well,
can't test you for heavy metals.
how comes? Because you can.
I can't,
Why
sorry.
not? Why not? Because it says
We're
on
not
the
allowed
it says
to
on,
request it.
yeah, I know, but it says on the website you can.
Which website?
NHS.
Sorry, we can't. There might be some specialist NHS
alright,
labs
alright,
that can, but
okay.
we can't.
Yeah, well, your website needs to be changed then.
Right, okay. We can't test for parasites really.
I
The
know,
only
because
test
you
for
use the
parasite we
parasite
can
of
do is a
PCR
test of
test.
your poo.
Yeah, I know, and use the PCR test for that one.
Well,
Yes, you do.
they might-
Don't lie. I know,
Right,
I've looked
I'm
into
not
things.
lying. So, one of the tests that they do of your poo is to look under a microscope to see if they can see any parasites.
Yeah.
And yeah, I think they do PCR as
Yeah,
well.
they do, I've looked into it.
Yeah, up to you. If you want to submit a sample of your poo, we can check that for parasites. You're welcome to do that.
Yeah, no, if you're going to do a PCR, because they can be faked.
Right. Okay.
I know that factual. The person who invented the test turned around and said he put it out there like
Okay. I think
person
that's
who-
something else we have to agree to disagree on.
the person who invented it.
Right.
Not you lot, not the person that make money out of it. The person who
Yeah.
invented it said it cannot be used.
No, I do not make money
Because
out
it
of
could
tests.
be, well they do, because
Hmm.
there's a specific multiplication of the the test thing, and I think it was 4%, but basically whether you go over or under and all that rubbish magnification, then you can get a false positive or false negative depending on what the scientist wants you to believe.
Okay. Fine. Those are the
So
tests
there.
on offer. If you're
Yeah,
concerned about
right.
your kidneys, I suggest you have them done. But
Right.
it's up to you. So blood tests you can book in for. Submit some urine. Have to be any day before 1 o'clock because we can't
Yeah.
send things off to the lab after
Yeah,
that.
yeah.
Submit some urine. Submit a poo test as well. So all those are options if you'd like.
Yeah.
You can book the blood test at reception.
But
and
that
then
was
store
that came
those
through as
samples.
what I basically thought it was going to
Well, a
come.
little bit of protein.
Yeah,
Yeah.
that's protein leakage from kidney failure. 70%
Potentially
kidney
it
failure.
can also be normal.
Before
so
you
it
go
was only
onto
low
a
level of
diagnostic
protein.
machine that you
Right.
get money from. That's something I'm never going
I
to do.
don't get money from them.
No, not you, but the people above you.
okay.
the hierarchy.
Right.
But yeah, I don't know. I know the way it works.
Right. Okay, so the offer's there then.
Yeah, I know.
It's up to you.
Yeah. Well, blood tests. Yeah.
Yeah.
But the PCRs, I do not have any trust in them at all.
Okay.
That's honest.
Fine, we'll put the blood tests in at least,
Yeah.
and we'll see if they show anything.
All right.
Okay.
Good luck. Thank you. I see you soon. Yeah. Take care.
Bye.
Bye. Bye.
Is that right? Is it? And it's brilliant. So if I send that across there, is that okay? guys can do it over the phone, I suppose. Yeah, I'll send it through. Thank you. Bye. Bye.
Alright.
Yeah, you alright?
Yeah, I don't know whether they're doing it or I have to put it here, blood test.
Oh, yeah, we have to book that for you.
For in here.
Alright. We're booking now for towards the end of this month unless we have cancellation.
Aye, all good.
I'll just do a quick search. Right, here we go. What have I got?
Administration of RSV vaccine.
We have got an early one on the 9th of July, like 8:30 or 8:40. Is that too early?
Is there anything later or is that the...
Not that day, that's a cancellation, but then it's the first one.
It doesn't ask for out of it, so fill the descriptive text, yeah?
Yeah.